I'm pleased to report that I took a COVID test yesterday, and I am negative from that test. So that is good news. You take one of those tests, it's very easy. I showed people how easy it was yesterday. And when you find out you're negative, it's actually a nice sense of relief. I didn't have any symptoms or anything, but you know, you don't need to have symptoms, and you can have the COVID virus. So you take the test, they tell you you're negative, 24 to 48 hours, and it is peace of mind. There's no reason why people shouldn't be getting testing. We actually have now more testing capacity than we are using at many of our sites. And we've expanded the number of people who are eligible for testing. Anyone who has any symptom for a COVID virus. Any symptom includes basically the symptoms you would have if you had the flu. Same symptoms. If you have any symptoms, get a test. Get a test. Protects you, protects your family, protects your colleagues, so get a test. If you were exposed to a person who you find out is positive for COVID, get a test. Get a test. Takes 30 seconds. We have 700 locations across the state. So there's no reason why you shouldn't do it. You go right to the web. It shows you right where the location is. You can sign up and go. Let's give you some facts on today. Number of hospitalizations are down, so that's good news. Not down a lot, but down. I'll take it. Net change is down. Net change in intubations is down. The number of new cases per day is down by 1. Not great, but I'll take it. It's going in the right direction. So that is good news. The number that breaks my heart every day, the number of deaths, is still painfully high at 106, but it is down. And in this world where we're looking for good news on a daily basis, that is good news. Although in our thoughts and prayers are those 106 families today. And if you look at where we are, we have done a phenomenal job in reducing the spike, reducing what could have been cataclysmic. You see that incline on that curve. No one could tell you when we were in the midst of that incline where it would stop or if it would stop. There was no global expert who said, if you do this, if you close this and close this and close this, then we can tell you with certainty it will stop the spread of the virus. Nobody said that. All they could say was, do your best, try to close everything down, and then hope for the best. And New Yorkers responded. We had the highest number of cases in the country. New Yorkers responded with great unity and great discipline, and that's why that curve turned. We hit the apex and we're on the way down. You also see how slow the way down is. That's why all the experts always say, be careful of the spike because it's a long time coming down from the spike. You want to avoid the spike because you can't reverse it in a matter of days. It takes a long time to get those numbers back down. And this is with everything we did and with all the loss and pain we suffered. This is how long it took to get those numbers down. We now have a top priority, which we have from day one, which is our nursing homes. We were introduced to this virus in Seattle, Washington, where it attacked a nursing home. The most vulnerable population in the most vulnerable place, senior citizens in a congregate facility. That's how we were introduced to this virus, and I'm afraid that's how we're going to leave this virus. So protecting our nursing homes and seniors has been a top priority. Last week, we put in place a requirement to test all staff at a nursing home twice per week. Why? Well, number one, it keeps the staff safe. Number two, if you see an increase in the positive among staff people, it's an alert that you probably have a real problem in that nursing home. because chances are the staff are getting it from the nursing home or giving it to people in the nursing home. So if you watch what happens with the staff, it's a canary in the coal mine for what's happening in the nursing home. And third, it clearly keeps the residents of the nursing home safe. Now, to help nursing homes do this, we've worked with all the private labs, identified a number of tests that we can send just for the purpose of testing people in nursing homes. That's about 35,000 per day. We're sending 320,000 test kits to the nursing homes today to help them do this. With everything we're doing, I know the nursing homes operators are not happy about this. I get it. It's very hard to administer. The staff all have to be tested twice a week. Okay, we're giving test kits. We've set up lab capacity, but it is still an operational issue. I understand that. And I understand that no other state is doing this. And I hear that quite often from the nursing homes. No other state is requiring that the staff be tested twice a week. I understand that. I understand we have the most aggressive standard in the nation. But I also know that it is necessary. And look, from day one, we said this was going to be hard. And we said we drew bad cards in this hand. New York did have the highest number of cases, not because we did anything wrong, but because the virus fooled everyone, and we were closing down China, and the virus had already left China and gone to Europe. And by the time we closed Europe, 3 million Europeans had come from Europe and landed in New York airports. And that was happening, and we didn't know. Closed China was already gone by the time we closed China. And it had left Europe by the time we closed Europe. That's why New York had that cluster. Those flights from Europe come here. They land in JFK, they land in Newark, people take connecting flights, they're coming here. So that brought the virus here. That's why we have the numbers we have. Okay, but we said we're going to do what we have to do, and we're going to do what we have to do to protect the lives of New Yorkers. Who's in a nursing home? This is your mother, this is your father, your sister, your brother. This is our family who are in nursing homes. That's who they are. And they're our senior family members who we owe nothing but gratitude and respect. And the one thing we need to be able to say at the end of this is we did everything we could. We did everything we could. 106 people died. How do you live with that? How do you sleep with that? Because we did everything we could. We still can't save every life, but we can do everything in our power that we can do to try to save every life. And that's why I'm comfortable with what we're doing on nursing homes. I know it's hard, and I thank them. On reopening overall, we're opening regions that have hit the data points, hit the metrics. Western New York has one metric that they have to hit, which is the number of tracers. They need 521 tracers. They've identified 525. Great piece of work that they did over the weekend. I want to thank the mayor. I want to thank the county executive, all the regional officials who found people to serve as tracers. They're going to be trained tomorrow, and that means all the metrics will be hit, and Western New York will open tomorrow. So that's exciting. And it's been a long, painful period, but we start to reopen tomorrow. New York State Department of Health is also granting a waiver to restart elective procedures for ECMC. We want to make sure hospitals are in a position to provide care for people who need it. So this is a good step. I also have been encouraging major sports teams to plan reopenings without fans, but The games could be televised. New York State will help those major sports franchises to do just that. Hockey, basketball, baseball, football, whoever can reopen, we're a ready, willing, and able partner. Personal disclosure, I want to watch the Buffalo Bills, but I'm still objective. I'm acting as governor. There's no personal agenda here. Yes, I do want to watch the Bills, but that is not subverting my role as governor. I think this is in the best interest of all the people and in the best interest of the state of New York, even though I do have a coincident personal agenda because I want to watch the Bills, but they are separate agendas. At least some would say I have a conflict of interest. I want to disclose it. Judges and staff will be returning to courthouses in the 30 upstate counties that are open this week. What will reopening mean? Right? That's a big topic of discussion now. What does reopening mean? This is not a subject that is a political subject or where political opinions really matter. I don't care if you're a Democrat, Republican, Libertarian, Independent. I don't care. I don't care. This is not a political exercise that we are going through. People say, well, I have a personal opinion. I don't even care about your personal opinion. I don't think you should care about my personal opinion. Because it's not about a personal opinion. It's not about an ideological opinion. It's not about a geographic opinion. It's not even an opinion that's relevant, right? This is about facts and science and data. These decisions are being made as a matter of math. It's numbers. It's math. That's all it is at the end of the day. You start to increase economic activity. You have more people coming out of their homes, more people contacting other people, and then you measure the impact of that increase with numbers. Not with opinions, not with politics, not with partisanship, with numbers. And then you just measure the impact. You make sure that you don't go above 70% of your hospital beds, so that if a large number of people get infected, you have the hospital beds to take care of them. You make sure you don't go over 70% of your ICU bed capacity, because when these people are infected with COVID, they do need ICU beds. We learned that the hard way. You have testing up and running of 30 tests per 1,000 residents. Where did that come from? That's the White House Coronavirus Task Force, Dr. Birx. You have 30 tracers ready for every 100,000 residents. That comes from the experts. And then you watch the infection rate. And you make sure that you don't get near 1.1 on the infection rate. It's math. And there's a liberation in that. At a time of such division and politics and elections and all this garbage, this is an exercise in science and math. And it's data that we can all share and we can all participate in. I encourage people to go look at the data and look at what's happening